Robert F. Kennedy Jr. himself has fingered aluminum vaccine adjuvants as a major cause of the chronic illness epidemic in the United States, and is also a likely leading factor in the vaccine autism link. So the fact that Jim O'Neill would market the very thing that RFK Jr. has linked to these conditions as a treatment for neurodegenerative disease tells you a lot about the guy. And that I think a lot of his ambitions are very counter to the idea of making America healthy again. If one of the key culprits per RFK in this chronic illness epidemic is something that he thinks can be deceptively marketed as a cure, it's very crazy.
Whitney Webb, a well-known investigative journalist, recently appeared on YouTube, putting light on the troubling connections between Jim O'Neill, the biotechnology sector, and the manipulation of public health policies. What is interesting is that Robert F. Kennedy Jr. has linked aluminum vaccination adjuvants to the chronic sickness epidemic in the United States, as well as the vaccine-autism relationship. Despite this, Jim O'Neill is promoting aluminum as a cure for neurodegenerative disorders, raising serious questions about his motives and the potential implications of his conduct. Webb's inquiry has revealed a web of deception and manipulation, including O'Neill's participation in the biotechnology industry and connections to powerful persons such as Peter Thiel. As Webb probes deeper into the story, it becomes evident that O'Neill's objectives could be at odds with the goal of making America healthy again. Let's watch clips from Whitney Webb's interview to gain more insight. Don't forget to like, subscribe, and enable notifications for additional in-depth content. Thanks for joining us again. Enjoy the video.
So my focus tends to be on policy and policy agendas. And I think, especially coming out of an electoral season, people tend to get very invested in people. And sometimes people don't necessarily stick to policy agendas they promoted on the campaign trail, and tend to sort of, I think, myopically focus on some of the narratives around the people at the expense of paying attention to the policy agendas they ostensibly oppose. So, as it relates to things like mRNA technology, for example, a lot of people that have been pretty prominent in opposing that have sort of glossed over some of the statements recently from people like Larry Ellison, the CEO of Oracle at the White House, talking about personalized mRNA cancer vaccines. A lot of people that railed against mRNA technology a year or two ago have been unusually silent about that. Of course, not everyone, but some have, presumably at the expense of, they don't want to necessarily criticize the incoming administration, but there are some, troubling signs as it relates to mRNA technology specifically. And if this was a major reason for people backing the Make America Healthy Again movement in particular, which has been credited with a lot of Trump's electoral success more recently, it's important to note that that policy agenda does matter to voters, and sort of focusing on, confirming this person or that person, or as long as this person got in, everything will magically be fine. I mean, that doesn't necessarily happen, as we know that in politics, a lot of deal making happens, a lot of backpedaling can happen, a lot of compromises happen that can, be at the expense of those policy agendas that voters really cared about. And so, I tend to focus on the policy agendas and sort of try and avoid a lot of the focus on politicians specifically, because, I think people, it happened with Obama. I think it's happened with Trump to an extent, this idea of hope and change and sort of these savior politics that as long as, we get the right person in the White House, we can all sit back in our armchairs and trust the plan. I kind of reject that. I think it's up to everybody to focus on policy agendas that they oppose, and if those start to be pushed through, that they get vocal about it, regardless of who's pushing about it or making excuses for it. Personally, I guess that has ruffled some feathers in my case, and not necessarily cheerleading people, has gotten me called a lot of names recently. But ultimately, I'm concerned about certain policy agendas, and I haven't changed in that. So a lot of the policy agendas I've been focused on for years really is the expansion of mass surveillance, the erosion of civil liberties, the imposition of technocracy, and also the imposition of this biotechnology that is deceptively marketed as safe and effective. When we learned during COVID, it is neither of those things. As we'll talk about today, as it relates to Jim O'Neill, there's efforts. His big push is to eliminate efficacy testing for drugs and vaccines, which would be a total gift to the biotechnology products that produced mRNA, because essentially what's been known for years since this technology first emerged around 2010 is that you can either make them safe but not effective, or you can make them effective but incredibly toxic. And so by eliminating efficacy tests, you can flood this on the market. And there's really, if you look into this guy's background, there's really, it's unlikely there will be any sort of imposition of rules that would prevent deceptive marketing of those things. And there's certainly ways to get this into people's bodies without necessarily having mandates, for example, and that could include a big pharma collusion with private insurance companies. It could include, getting mRNA into the food supply, which is being done with livestock, among other things. So again, if people are concerned in the MAHA movement, particularly about mRNA technology, it's important to look at the policy action and not so much the policy rhetoric, if you want to avoid interacting with those type of substances at all, personally.
So who is Jim O'Neill, and why should we know about him, and why should we be concerned?
Right. So as I noted in the piece, Jim O'Neill has a kind of lengthy career that spans both the private venture capital scene, and also before that, he had a stint at HHS as well during the George W. Bush era, where he was the top speechwriter for Tommy Thompson and later Mike Leavitt. And, under Tommy Thompson, he was head of HHS during the anthrax attacks and pushed for a lot of this legislation that used as justification the 2001 anthrax attacks to push through things like emergency use authorization, which have justified under emergency. So a lot of that history goes back to piggybacking off the 2001 anthrax attacks, which, if anyone's familiar with that, was essentially a false flag attack quickly tied back to the U.S. military, even though attempts were made to blame it on Saddam Hussein and Al-Qaeda back when the anthrax attacks first occurred. And if anyone's familiar or would like to know more about that, you can look at my series, Engineering Contagion, that I wrote several years ago during the COVID era. About that specifically. But, as top speechwriter, writing those speeches for Tommy Thompson before Congress, for example, Jim O'Neill was involved in manufacturing consent for that type of legislation and that deregulatory paradigm. That was, justified by the anthrax attacks, and also the fear mongering around the bird flu scare that was roughly between 2004 and 2006.
Whitney Webb noted the importance of prioritizing policy agendas over individuals, especially following an election campaign. She observed that people frequently become invested in politicians and fail to examine whether they adhere to their policy agendas. Webb pointed out that some opponents of messenger RNA technology had been quiet regarding Oracle's CEO's recent comments on individualized messenger RNA cancer vaccinations. She found this troubling, particularly for supporters of the Make America Healthy Again movement, which has been linked to Trump's electoral victory. Webb emphasized that policy agendas are important to voters, and that focusing simply on confirming a specific candidate might lead to a neglect of these priorities. She highlighted the murky waters of politics, which might involve deal-making, backpedaling, and compromises, perhaps at the price of voters' concerns. Webb mentioned Jim O'Neill's desire to abolish effectiveness testing for medications and vaccines, which she believes will favor biotechnology businesses that produce messenger RNA technology. Let's watch more clips from the interview.
And a lot of that fear-mongering was piggybacking off of the statistics of incredibly discredited people like Neil Ferguson of the Imperial College of London, who, of course, created those doomsday statistics about COVID-19 that justified a lot of the lockdowns and other things. And, of course, his statistical modeling and all of that has since been heavily discredited. But that was the kind of modeling that was, cited by Thompson and Levitt and others in these speeches that O'Neill was helping to write, and the extreme fear mongering, and as well as this legislation that O'Neill helped manufacture consent for, created this entity at HHS called BARDA, which is responsible for purchasing large amounts of big pharma products under the guise of stockpiling them for emergencies. And so that was passed, and then this bird flu panic was falsely generated, largely off of the fear mongering of speeches of HHS secretaries. In doing so, they pushed for billions of dollars spent on the purchase of Tamiflu. Tamiflu is an antiviral manufactured by Gilead, and at the time, then Secretary of Defense Donald Rumsfeld had previously been chairman of Gilead, held an insane amount of stock in Gilead, and made over $25 million as a consequence of this huge pump and dump, basically, in Gilead stock that was, a direct consequence of the mass government purchasing of Tamiflu stockpiles that was never ultimately needed. It was basically a scam. And a lot of BARDA stockpiling over this fear mongering of, the next pandemic and all of that, a lot of these antecedents, Jim O'Neill first established in his public sector career, and then he leaves. By the way, he was also on the BARDA steering committee when those decisions were made to purchase Tamiflu as well. Jim O'Neill leaves in 2008 and enters the private sector, and he does so immediately, essentially linking up with Peter Thiel of PayPal Mafia fame. Peter Thiel, during the George W. Bush administration, had teamed up with In-Q-Tel, the CIA's venture capital arm, to privatize the massive surveillance program, Total Information Awareness. Then housed at DARPA, they turned it into a private entity with CIA money, and that company, of course, is Palantir. Jim O'Neill worked at Clarium Capital and then later at Mithril Capital, where he oversaw massive investments in Palantir, and also investments in a lot of biotechnology companies, some of which were very controversial, like Ubiome, which essentially was a giant fraud, not unlike Theranos, and its co-founders were indicted on like 40 charges of fraud, and sent to prison for basically what was this giant biotech technology scam. And also at Mithril, Jim O'Neill was the superior of current Vice President J.D. Vance, so they presumably know each other quite well. And moving downstream of that, it's not just the history of Jim O'Neill, it's his current affiliations that I think raise cause for concern as well. So I note his current ties to biotechnology companies in the piece. And the most glaring of those is his membership on the board of directors of this company called Advantage Therapeutics. And Advantage Therapeutics is essentially marketing injections of pure aluminum, which is a known neurotoxin, and trying to market that as a cure or treatment for Alzheimer's disease, which of course is a neurodegenerative condition. And there's actually no data linking the injection of aluminum into better outcomes for Alzheimer's patients. Basically what happened, the people behind this company previously tried to create a vaccine to treat Alzheimer's. And in the study, the control group did much better than the group that received that vaccine. But the control group was given the vaccine minus its active component, just the vaccine adjuvant or immunostimulant, which was this aluminum product. And they claim that because the control group did better, that must mean that the aluminum is a treatment for Alzheimer's. And so they got the patent rights to it and attempted to monetize it. But only the scientists affiliated with this company found that finding, or interpreted the data that way. The other people said the outcomes observed in the control group are observed in Alzheimer's patients that undergo no treatments at all. And Jim O'Neill was brought on the board specifically to market this, or to get this particular product onto the market, despite no data and despite the fact that it's a known neurotoxin, and aluminum specifically has been investigated as a causative factor in the onset of Alzheimer's. And going even beyond that is the fact that Robert F. Kennedy Jr. himself has fingered aluminum vaccine adjuvants as a major cause of the chronic illness epidemic in the United States, and is also a likely leading factor in the vaccine autism link. So the fact that Jim O'Neill would market the very thing that RFK Jr. has linked to these conditions as a treatment for neurodegenerative disease tells you a lot about the guy. and that I think a lot of his ambitions are very counter to the idea of making America healthy again. If one of the key culprits per RFK in this chronic illness epidemic is something that he thinks can be deceptively marketed as a cure, it's very crazy. And when you consider also that he wants to deregulate efficacy tests and sort of it's quite unsettling. And if you look at the people that he says inspired him in developing his views on deregulation, there's some of these figures that I note in the article that essentially state that big pharma should be responsible for the clinical testing of their own products, which is totally bonkers. And supposedly the ambition of the Make America Healthy Again movement is to separate take big pharma out of the regulation, take big pharma out of the FDA and that revolving door and things of that nature.
Whitney Webb explained how fear-mongering methods were used to justify lockdowns and other measures during the COVID-19 epidemic, citing suspicious data from Imperial College London's Neil Ferguson. This form of modeling was mentioned in speeches by Jim O'Neill, who helped persuade Congress to establish the Biomedical Advanced Research and Development Authority at the U.S. Department of Health and Human Services. According to Whitney, then Secretary of Defense Donald Rumsfeld, who had previously led Gilead, profited more than $25 million on the massive government purchase of Tamiflu stockpiles, which was eventually deemed unneeded. Webb additionally mentioned Jim O'Neill's move to the commercial sector, where he collaborated with Peter Thiel, co-founder of PayPal, to privatize the Total Information Awareness Monitoring Program. O'Neill managed investments in biotechnology businesses, some of which were involved in disputes and fraud. Whitney Webb's investigation raises critical concerns about the intersection of politics, public health policy, and corporate interests. The revelations about Jim O'Neill's role in shaping biotech policy, his ties to influential figures, and his push to remove effectiveness testing for vaccines and medications suggest a broader agenda that may not align with public well-being. The connections to Peter Thiel and the privatization of government surveillance programs further highlight the potential conflicts of interest at play. As we continue to analyze these claims, it's essential to remain vigilant and question the narratives presented by those in power. Public health policies should prioritize transparency, safety, and scientific integrity rather than being driven by corporate profits and political maneuvering. What are your thoughts on these issues? Do you think these connections are coincidental, or do they point to a larger, coordinated effort? Share your opinions in the comments, and stay tuned for more investigative content. Thanks for watching, and don't forget to like and subscribe.